You're listening to an African Elements top news story for April 7th, 2025. Please visit our website at africanelements.org for more daily news. Africa Maternal Mortality, SDG Targets. 2030, Progress and Woes, by Darius Spearman, African Elements. It's a hard truth we need to face. Africa is falling behind on a crucial promise. The United Nations warns the continent is way off track to meet the Sustainable Development Goal targets for reducing maternal mortality by 2030. While there's been progress, it's just not fast enough. Consequently, too many of our mothers are dying from causes we know how to prevent. The Sustainable Development Goals, or SDGs, are a set of 17 global goals adopted by the UN back in 2015. They aim to tackle big world problems like poverty, climate change, and health inequalities. Specifically, SDG 3 focuses on good health and well-being, with a key target being the drastic reduction of maternal deaths. This fight is personal for many in the diaspora, connecting us directly to the well-being of our families and communities on the continent. Let's look at the numbers. The African region has indeed seen a significant drop in maternal deaths. Since 2000, the rate fell by 40%, from a staggering 727 deaths per 100,000 live births down to 442 in 2023. That reduction represents countless lives saved and families kept whole. We must acknowledge this hard-won progress. However, the current pace isn't cutting it. The SDG target is ambitious but vital: fewer than 70 maternal deaths per 100,000 live births by 2030. To get there, Africa needs a much faster annual reduction rate than the current 2.2%. At this slow crawl, projections show the region will only reach about 350 deaths per 100,000 live births by 2030. Ultimately, that's nearly 5 times higher than the goal we committed to, a stark reminder of the challenge ahead. The statistics paint a grim picture of maternal and newborn health across the African region. Each year, around 178,000 mothers and 1 million newborns die from preventable causes. Globally, about 260,000 maternal deaths occurred in 2023. That's one death every 2 minutes. Tragically, sub-Saharan Africa carries the heaviest load, accounting for roughly 70% of these global deaths. The situation is even more dire in areas plagued by conflict or instability, often referred to as fragile settings. These regions typically suffer from weak governance and economic hardship, severely impacting healthcare access. For instance, countries like Chad, Nigeria, and Somalia face some of the highest risks. Consider this sobering fact. A 15-year-old girl living in a fragile setting in sub-Saharan Africa faces a shocking 1 in 51 lifetime risk of dying from maternal causes. In contrast, her counterpart in a stable area faces a 1 in 593 risk. Clearly, instability dramatically magnifies the danger for expectant mothers. The challenge extends beyond mothers to their newborns. Neonatal mortality, defined as deaths within the first 28 days of life, remains alarmingly high despite progress. The African region has seen neonatal death rates decline by 33% since 2000. While commendable, this improvement is insufficient to meet the SDG target of 12 or fewer deaths per 1,000 live births by 2030. The leading causes behind these tiny lives lost include preterm births, infections like sepsis, complications during childbirth, and congenital anomalies. Access to specialized newborn care can make a life-or-death difference. Unfortunately, such care is often lacking, particularly in rural communities and conflict-affected areas. Addressing both maternal and newborn survival requires tackling these shared root causes head-on. Therefore, integrated care is essential. The tragedy deepens when we realize most of these maternal and newborn deaths are preventable. For mothers, the main killers include severe bleeding, high blood pressure during pregnancy, infections, complications from unsafe abortions, and problems during labor like obstructed birth. Timely access to skilled care during pregnancy, childbirth, and the postnatal period can prevent or manage these conditions effectively. Systemic barriers, however, stand in the way. Cuts to funding, especially international aid, threaten the progress already made. This is particularly dangerous in fragile states. Furthermore, weak healthcare workforces, a shortage of facilities equipped for emergency obstetric care, and ongoing conflicts create a deadly combination that increases risks for mothers and babies. These systemic issues demand systemic solutions, including robust international partnerships as envisioned under SDG 17. Recognizing the urgent need, the World Health Organization is actively working to accelerate progress. They are rolling out specific maternal and newborn health acceleration plans across the African region. These plans focus on expanding access to quality antenatal and postnatal care. Critically, they also aim to strengthen skilled birth attendants, ensuring trained professionals like midwives or doctors are present during delivery. While the sources don't provide granular details on every specific program, the overall strategy aligns with SDG 3. Copyright: African Elements.